It's time for Preserving Your Dignity and Your Money, Planning for Successful Aging with Nugen Law. And now your host, J. Bryan Nugen, estate planning and elder law attorney.
Good morning, and welcome to Preserving Your Dignity and Your Money, Planning for Successful Aging with Nugen Law. I'm attorney J. Bryan Nugen, founder of Nugen Law, and your host for our program. The purpose of our show is to have weekly, in-depth conversations about matters relevant to folks as they walk down the path of successful aging. Our listeners will learn what it is to age with dignity and how best to protect their money. I've been practicing law for 3 decades. I'm licensed to practice in Indiana, Ohio, Michigan, and Florida, and actively represent clients in all 4 states. My practice, the attorneys and our interdisciplinary team of professionals who practice with me concentrate on working with clients in estate planning and elder law and areas related to them, such as protecting money from nursing home stays, securing benefits from programs like Medicaid and the VA, geriatric care coordination, estate and trust administration, guardianships, and planning for those with special needs. Nugen Law sees clients in many stages of life, but commonly we have folks reaching out when they or a loved one are showing signs of needing help. Those signs may include a chronic ailment or progressive decline before, during, or after a hospitalization, an instance of incapacity, caregiver burnout, stress on family members due to some or all of those instances I just mentioned. As a reminder, Nugen Law represents clients in Indiana, Ohio, Michigan, and Florida. We also take a life care planning approach to client representation, meaning that not only do our attorneys prepare any legal instruments appropriate for your unique situation, without additional cost, our clients also have access to our affiliated CPA firm for preparation of their tax return, are invited to our client-only educational opportunities, have access to our Medicare specialist who advises on what Medicare plan and supplemental plan to secure, the ability to have your legal documents revised as necessary when appropriate, and also unlimited access to our elder care coordinator, a person who assists with whatever help our clients may need as they age, including setting tours of various facilities, arranging for help in client homes, arranging moving and downsizing, advocating for Nugen Law clients when necessary, learning things about programs such as PACE, which we're going to talk about more in depth today. If you hear something in today's broadcast which resonates with you, an area in which we may be able to help, please call Nugen Law at 260-925-3738, speak with one of our intake specialists, and schedule a meeting for either our Fort Wayne or Auburn locations. You are also encouraged to see us online at www.nugenlaw.com. Today, I have a special guest with me in the studio. It's Emily Baumgartner. Emily is the Enrollment Director for PACE of Northeast Indiana. She has been with PACE for 3 years now. Emily does outreach to local senior living communities and networking programs to spread information about the program. She also does visits to the homes of those who are interested in services through PACE, P-A-C-E, PACE, to ensure they understand the program and assists with the enrollment process for those individuals. PACE is a program that clients of Nugen Law have enjoyed and will continue to enjoy for years to come. Because of that, I wanted to bring Emily to our radio show to share with you this exciting service. Emily, welcome.
Hi, thanks for having me.
Of course. Let's start with the acronym PACE, P-A-C-E. What does PACE stand for?
PACE stands for Programs of All-Inclusive Care for the Elderly.
And let's expand that a little bit. What is the PACE program?
So PACE is a home and community-based program that is available to individuals in Allen County that is designed to assist them with remaining in the community to age in place, if that is something that is safe for them to do. So we are an all-inclusive healthcare program that provides some services like in-home care, so a home health aide to help out with some day-to-day tasks that may be a little bit harder on an individual, like getting dressed, taking their medications, taking a shower, fixing a meal for the day, whatever it may be. We're able to help out with that. We also are able to help out with coordination of medical appointments and getting transportation to those medical appointments. We also have a building that's located on Lake Avenue in Fort Wayne. And in that building, we have a day center where our participants are able to socialize. A lot of the issues that I see whenever I'm doing visits with individuals in the home, they're a lot of times related to social isolation. So having that outlet to make friends and just be around other people that may have common issues to them, a lot of times really helps them out. So they do that. We do therapy services. We do medical care. So it's kind of a one-stop shop for a lot of the conditions.
You referenced aging in place, and that's a phrase that in my world we use a lot, and obviously in your world you use a lot. So for our listeners, define what that means.
So aging in place means that you're staying where you want to be for the rest of your life if we can help it. So that means that you're able to stay in your home in the community utilizing other services like home care or like case management services or anything like that. And with the support of those services, you're able to stay in your home versus having to go to a facility setting and, uprooting your whole life and packing up your life to move to a facility when you want to stay at home.
You referenced earlier about arranging for transportation. That's a hot topic for seniors. What services do you arrange for them as far as their transportation? How are you able to arrange that for them and so that they can get to their medical appointments, et cetera?
Yeah, so with the PACE program, we're very lucky. We do our own transportation. Mm-hmm. So with being the medical provider for our participants, where we know about all of their appointments they have, we're able to see when they need taken to an appointment. So we're able to schedule our own transportation to be able to pick them up, take them to that appointment, be there when they're done, and take them back home afterwards.
All right. Excellent. So if they're working with PACE, are they able to use a medical provider outside of a PACE medical provider, or they're locked into using just those providers?
So PACE is the medical provider for our participants just because of that main goal that we have with keeping our participants living in the community. We keep a closer eye on our participants' health conditions than someone would get with a typical medical provider that they may have on their own. So because of that, we do provide those medical services for them through us.
And you mentioned earlier about Allen County, but just to be, our listeners are beyond the Allen County area, but this PACE program that you're part of is strictly limited to those that are residents of Allen County.
Correct. Yes. Our PACE program is actually connected to our local area agency on aging and in-home services. So for individuals who may be outside of Allen County, there are still plenty of resources that are available to you by just contacting aging and in-home services directly. They have a resource center where they're able to get you whatever information is needed for your specific area.
And there are PACE programs in Indiana aside from Allen County, correct?
Correct, yes. The specific one to Fort Wayne was opened and was the 5th in Indiana, I believe, when we opened back in 2021. Since then, a few others have popped up all over the state. So a good resource people are able to use if you're looking for a specific PACE in your area. The National PACE Association does have a website where you're able to find your local PACE program.
Excellent. So, let's assume a listener is hearing this today and, gosh, it's piquing their interest. What's the eligibility for being a PACE recipient? So
you just need to be 55 or older, live in Allen County, be safe to be in the community, and meet a nursing home level of care. And we figure out those last two details by doing some home visits with you, where we figure out what exactly you're needing assistance with in the home, verify that being at home is the safest option for you, and then that's how we're able to provide services for you.
I like to describe it as it makes sense for you to remain in your home. With that additional help, of course, allowing them to age in place, so long as it makes sense and it's healthy and safe for them.
Absolutely. Yep. Safety is always our number one priority when we're looking to provide any sort of care for an individual. We just want to make sure that you're in the safest spot that you can be.
Do you have to have a certain diagnosis to be eligible for PACE?
Nope. So you really can have any sort of diagnosis. There's not one set diagnosis that someone may have that would automatically make them eligible. People can have a variety of issues, from Alzheimer's to COPD to chronic pain, things like that. We're very individualized as a program, and we understand that every person is different. So we're able to take each individual person as they are and figure out what we can do to help them out.
As a reminder to our listeners, Nugen Law represents clients in Indiana, Ohio, Michigan, and Florida. We also have a life care planning approach to client representation, meaning that not only do our attorneys prepare any legal instruments appropriate for your unique situation, without additional cost, our active clients have access to our affiliated certified public accounting firm for preparation of their tax return, are invited to our client-only educational opportunities, have access to our Medicare specialist who advises on what Medicare plan and supplemental plan to secure, the ability to have your legal documents revised as necessary, and, when appropriate, unlimited access to our elder care coordinator, a person who assists with whatever help our clients may need as they age, including setting tours of various facilities, arranging for help in client homes, arranging moving and downsizing, and advocating for Nugen Law clients when necessary, even arranging and making referrals to a program like PACE, which we're talking about in today's show. If you hear something in today's broadcast which resonates with you, an area in which we may be able to help, please call Nugen Law at 260-925-3738, speak with one of our intake specialists, and schedule a meeting for either our Fort Wayne or Auburn locations. You're also encouraged to see us online at www.nugenlaw.com. Emily Baumgartner, Enrollment Director for PACE, Northeastern Indiana, is our studio guest today. Emily, if somebody has heard something about PACE that it's piquing their interest, is there a phone number that they might call to contact you or someone else on your team?
Yes. Our direct phone number is 260-469-4148. And by dialing that number, it'll put you through to the PACE Center, and then you can speak with a member of the enrollment team. We'd be happy to go over some information with you and schedule to do a home visit.
Great. So 260-469-4148 to speak with Emily or another member of her team about becoming a recipient of the PACE benefits. Emily, if one of our listeners were to hire a home care agency directly, so they need help in the home, they're hiring them directly, what tasks would they help them with?
So any agency that you would hire to come in the home, they're able to help with some basic tasks in the home that you do every day. So getting a shower, and that could be just having supervision while you're there to take a shower in case of a fall. It could be physically helping you in and out. It can be physically showering you. It really, they're able to do whatever's needed there. They can assist with getting dressed, making a meal,
using the restroom, medication reminders.
Yep, especially reminding to take the medications. That helps a lot of folks out.
Sure.
Even doing some light housekeeping, like changing out your sheets on your bed, or running a load of laundry, or doing some dishes for you, or even meal prepping for the week, putting away some food to be able to warm up later on in the week, so it makes it a little bit easier on you on maybe the days that those services aren't in the home.
Mm-hmm. How would that differ if a listener were to be receiving assistance through the PACE program?
So you still get those same basic benefits through any services PACE would be putting in the home. We cover all of that care, plus extra services such as a device that's able to detect falls. So like a life alert, people think of, that you wear around your neck or something like that. we cover those. Home delivered meal services. So sometimes, cooking a meal really is a little bit harder on an individual. And maybe it'll be easier if you already have some meals that you could just pop in the microwave and you can eat that day. We also are able to provide that extra medical oversight with the program, because whenever you're on PACE, it's an all-inclusive healthcare program, so you get all of this stuff available to you. So the transportation, help with your medical conditions, the socialization, physical, occupational, and speech therapy. We do all of that in our building as well. So really, our program is good if just having a little bit of home care isn't quite cutting it for you, and you just need a little bit of that extra care to be able to stay in the home.
Sure. I've had the opportunity to tour your beautiful, and it is a beautiful PACE facility located at 2927 Lake Avenue, Fort Wayne, 46805. That's 2927 Lake Avenue in Fort Wayne. Emily, first, please describe what one sees when they visit or use the PACE facility.
Yeah, so once you walk into our day center, right in front of you, it's just windows everywhere.
Right.
We're situated back in a woodsy area there off Lake Avenue.
It's this lovely ravine.
Yeah, you wouldn't think that view would exist.
Yeah.
Going
So
down Lake
pretty.
Avenue. We got really lucky with that location.
Yep.
So we have tables that sit by the windows. We also have there's a creek down below that you're able to look at. We have bird feeders, so different birds like to come and fly through there during every season, and then it's just a big open space with all of these tables, so you have the freedom to be able to choose where you want to sit. If you want to make friends and sit with somebody and have a conversation, you can do that. We also have quiet rooms available. If it gets a little bit loud for you, or you're just really tired that day and need to take a little cat nap, you're able to go back there and rest for a little while. We have an activities area. So for really any hobby you might have, you're able to do it there. We have coloring pages, puzzles, card games, board games, books, you name it, we have it basically. So it's very, we're very fortunate to have the space that we do. When you come to our building, it doesn't really feel like you're coming to a medical facility. It feels like you're just coming somewhere to hang out. And in the meantime, a nurse is grabbing you and taking you back to check you out for something. And then you're coming back and eating lunch.
So I already know the answer, of course, as I've been there. But when you walk in, you have the beautiful open area, as you're saying. To the right is a nice activities area, lots of tables and cabinets full of things. But on the left side, then, is a medical facility. And you're associated with what provider?
We are partnered with Parkview Health on our clinical side. So all of our medical staff are hired through Parkview.
All right. And so there is describe the medical office that's there on site, what it can do, what it can't do, what people should expect to receive if they were a member of PACE.
Yeah, so whenever you go over to the left there and go into our medical section there, it looks like your typical doctor's office. Really, I always tell people the main difference is there's a view, because we also have windows in there as well. So anywhere you go, you're getting some natural light. And in our primary care office, we're able to do, your initial assessments, any follow-up visits that are needed, sick visits. We're also able to do things like wound care and blood draws for labs and things like that, a little bit more than a typical primary care office is able to.
If someone is a part of the PACE program, we talked about transportation earlier, do you pick up your PACE participants and bring them to the day center?
Correct. And if the participant is able to drive themselves, or if family is wanting to drive them, or even if we bring them to the center and family wants to come pick them up because they're in town that day or something like that, they're able to do that.
The facility has two levels. So you walk in, that's the first floor, I suppose, but the basement or the lower level. Explain for our listeners what happens down on the first floor.
Yeah. So on that lower level down there is where all of our therapy services live. So I'd mentioned earlier, we do physical, occupational, and speech therapy services through Parkview Health. So any services that somebody is needing, whether it's to improve conditions or help them keep their strength so that way they can remain in the home, we're able to do that. We have an indoor track down there. So a lot of our participants love to walk. Problem is, we live in Indiana where it gets really cold for a big part of the year, so can't really do that in the wintertime. Yes, it's slippery outside. It's just bad news for everybody. So they're able to use that indoor track down there, walk around for a little bit. We also have an exercise class that meets down there. We have some games. We have a little basketball hoop down there. We have some skee ball down there. So a lot of stuff for people to do. And then on another part of that level down there, we have machines. So our participants are even able to just come down and work out if they want to. They don't even need to be on therapy services to utilize some of those machines.
So we spoke about how someone would qualify, right? So nursing home level of care is necessary. Let's talk about the cost of the PACE program. How much is this costing the person, or is there a needs-based test for them to go on the program? What are we looking at there financially?
Yeah, so our program is covered by Medicare and Medicaid. So, for example, if you're working with an attorney like yourself to get on that Medicaid coverage, it covers our program completely. And we cover everything that is needed for your care to remain in the home and in the community. If for some reason there is a Medicaid spend down needed, or anything like that, we do have different private pay options that we're able to go over with individuals if that becomes something that would be something they would look into.
What percentage of your clients, I don't know if you call them clients, what patients, maybe you call them?
Participants.
Participants, yep. Thank you. Sorry, I was looking for the right word.
It's okay.
So what percentage of your participants are receiving Medicaid? And using the PACE program? Yeah,
so I would say, I'm trying to think back to some MPA statistics here. I believe it's right around 95% of our participants are dual eligible, which dual eligible means you have both Medicare and Medicaid. Yep.
Excellent. In regard to your facility, how often are you seeing your participants coming to the day center and enjoying use of the day center?
Typically, we see our participants anywhere from 1 to 3 days a week on average. It really is just dependent on their specific needs and their wants also. If somebody really is needing some therapy services, then we might bring them in a couple days a week to be able to do some therapy. If somebody is not really wanting to socialize much, they just need to come in to be checked on by the doctor every once in a while, then they don't have to come into the center if they don't want to.
Are there folks that can you attend the center more frequently, or do you have some participants that are there, if not a daily basis, almost a daily basis because they enjoy it and the social?
Absolutely. Yep. So if we're assessing somebody and they tell us that they want to come in a little bit more frequently, we have a team of individuals. We're called the interdisciplinary team. We kind of metaphorically wrap our arms around each participant to keep an eye on their services to see if they need anything additional or if we need to tweak anything. So if they're bringing it up to us that they would like to come in a little bit more often, the ID team will talk about it and we'll see if it would be beneficial to somebody, if they're really, if it's really pepping them up to be able to come into the day center every single day to have those relationships and just have something to do, then absolutely we're able to look into bringing them in more.
Excellent. As a reminder, if one of our listeners is wanting to learn more about the PACE program, P-A-C-E, PACE program, the phone number there at PACE is 260-469-4148, 260-469-4148. As another reminder, Nugen Law represents clients in Indiana, Ohio, Michigan, and Florida. We take a life care planning approach to client representation, meaning that not only do our attorneys prepare any legal instruments appropriate for your unique situation, without additional cost, our clients also have access to our affiliated Certified Public Accounting, CPA firm for preparation of their tax return, are invited to our client-only educational opportunities, have access to our Medicare specialist who advises on what Medicare plan and supplemental plan to secure, the ability to have your legal documents revised as necessary and when appropriate, unlimited access to our elder care coordinator, and our elder care coordinator, ECC as an abbreviation, is responsible for working with our clients to make sure that they are aging successfully, that they are aware of what resources are available to them in the community, like the PACE program. Our ECC may set tours of various facilities, arrange for help in client homes, arrange moving and downsizing, and advocating for Nugen Law clients when necessary. If you hear something in today's broadcast which resonates with you, an area in which we may be able to help, please call Nugen Law at 260-925-3738. Speak with one of our intake specialists and schedule a meeting for either our Fort Wayne or Auburn locations. You are also encouraged to find us online at www.nugenlaw.com. Emily Baumgartner is our guest in the studio today. She's the enrollment director at PACE, P-A-C-E. So, Emily, what type of capacity does the Allen County PACE program have? How many participants can it benefit?
So as of right now, when we're recording, we are at 108 participants on our program. So we do enrollments at the first of every month because of Medicare and Medicaid guidelines there. So throughout each month, we're doing home visits with individuals who are interested, and then making sure that they have everything that's needed to be able to enroll onto our program.
And what's your maximum capacity?
We don't have one.
Oh, my gosh.
Yeah, which is great because we don't bring our participants in every single day. We're able to have a capacity that's really the sky. Yeah.
I'm surprised that you only have 108. I mean, that's a great number of participants, but it's such a beautiful program. Why do you think it is that you don't have more participants right now?
Yeah, and a lot of people, when they hear that number, they think exactly that, like, wow, that doesn't seem very large. But we opened in July of 2021,
COVID.
and yes.
Well, so, we're gonna, a year or two doesn't count, right?
Right. And so we have actually, we're very fortunate to have the partnerships that we do with Aging and In-Home Services and Parkview Health, because those are two entities that throughout the beginning of the pandemic and throughout the thick of it, they were continuing to find people services. They were continuing to search and see what can keep people in the home. Because of that, we were able to grow actually a lot more rapidly than a typical PACE program would do. So usually when a PACE program is opening, they have to do a lot of outreach to the community and educate different service providers on their program and what they can do to be able to get referrals. With us, we had two really, really big entities that were referring people, and they were able to get people connected with our services a lot quicker than we would have been able to without those partnerships.
Mm-hmm. How are you spreading the word in the community about the PACE program? Of course, you're a guest today on our show here at Nugen Law, but how is it that you're getting the message out to potential participants?
Yeah, so, doing things like this. I'm also a part of some networking programs in the community where I connect with a lot of service providers and professionals in the industry that work at area facilities, area home care agencies, and other programs, so that way they know about our program and they can connect us with them. We also do health fairs. We do the Allen County Health Fair every year, the Senior Information Fair, which is going to be in, I believe, the end of August that's happening. So depending on when this comes out, it might be around that time. We do things like that to really just reach out to the community, and we really just depend on word of mouth. So I'd love to talk about the program, so you'll hear me yapping everywhere about PACE.
Do you anticipate the PACE programs becoming more and more prevalent throughout the state of Indiana?
Absolutely. Like I said, we were the fifth one to open back in 2021, and then they just keep popping up after that. Same thing is happening nationwide. A lot of people are seeing the real good in PACE programs in keeping seniors in their homes for a lot longer than if they didn't have PACE. So they're being developed all the time.
Excellent. Yeah. Well, I would encourage folks, if they haven't taken a tour, to give Emily a call and 260-469-4148 to see their lovely facility at 2927 Lake Avenue, Fort Wayne, 46805. It's in the 05. I would encourage folks to see that. Thank you, Emily. I sincerely appreciate your being in the studio with us today. She's the enrollment director at PACE. Nugen Law appreciates working with you and will continue doing that into the future. You've provided some invaluable insight today. I look forward to next Saturday, 9 a.m. for Preserving Your Dignity and Your Money, Planning for Successful Aging with Nugen Law. Enjoy your weekend, folks.
You've been listening to Preserving Your Dignity and Your Money, Planning for Successful Aging with Nugen Law. For more information, log on to NugenLaw.com or email help@NugenLaw.com. Nothing stated in today's program should be considered as legal advice, should not be considered as having created an attorney-client relationship between show host and guests and any listener. Nugen Law is not liable for anything that happens as a result of a listener relying on provided information as legal advice. The content is for informational purposes only.
Podcasts by Federated Media.